Good afternoon, everyone. Thank you so much for joining us today as we talk about the occupational therapy programs and the new occupational therapy doctorate program at the University of Vermont. We're super excited to have this conversation with you today. A few housekeeping notes. There is a chat box. Please put your questions in that chat box throughout the presentation. The session is being recorded, so if you are not able to stick around the whole time, you will receive the recording in your email afterwards if you have RSVP'd. And I see that we have a few more people that are probably going to join us in a minute. So let's get started. And then as more people come in, we're happy to go back and answer additional questions as needed. So we're going to go over introductions. We're going to really dive deeper into the new entry-level occupational therapy doctorate program at the University of Vermont, which is brand new for us. So we're so excited to launch this in a year. It'll be fall 2022. And also for students who might not have the prerequisites for the OT program, OTD program, and or want to strengthen those prerequisites. We have a pre-occupational therapy specialized track in our Post-Bacc Premedical program that we'll talk about here as well, to really set students up for success in the OTD program. And I'm just going to briefly talk about what is that PreOT, Post-Bacc Premedical program, and then we'll have plenty of time for questions throughout the presentation. So as I mentioned, please do put questions in the chat, and I'll make sure that we can get those answered throughout the presentation. My name is Nicole Fenton. I work in our continuing and distance education, and I'm so fortunate to have Victoria with us as well. She is leading our new OTD program, and she is behind the scenes actively setting up so much for this program to launch in 1 year, and we'll hear so much more from Victoria throughout the presentation. And she's so kind at the end to add her email address on a contact slide, so if you indeed have very specific questions, she is more than willing to hear from you and answer those questions. So let's start there. So Victoria, walk us through what indeed this is new to UVM, which is incredibly exciting. And I'm sure there's so much groundwork that's being laid down right now to be able to launch it in a year. Walk us through what is the new OTD program at UVM.
Okay, so thank you for the intro and for the opportunity to do this. We're very excited. Not only is the UVM community excited, the OT community in the state of Vermont is actually very excited about this new OTD program because it is the first entry-level OTD program or OT program in the state of Vermont. So there's never been an OT program here before. So what's been exciting about this is that as we've been developing the curriculum, we were holding little focus groups with OTs from the community in all the different practice areas that you can think of, and even some new emerging practice areas. So we certainly had people from mental health, we had people from pediatrics, we had people from the school district, we had people from the hospital, we had people from home health. And we pulled people together in these small little groups and said, okay, we're doing this. We're starting an OT program here in the state. You know, what do you guys think is important? What do you guys want to see in this OT program? How can this program really support the community? And through those focus groups, our curriculum was developed. And so that was a very fun way of developing a curriculum, because it meant that not only, you know, of course I'm going in with my own ideas, right? And UVM's coming in with their own ideas, but this was a way for us to really connect with the community. And what that meant is that we had so much community support and involvement in designing this curriculum. And what people really said was the science is very important, but we can't lose the creativity and the innovation that really is the OT profession, because really that's our profession. You know, we try to figure out what's the best way to get somebody back to doing what it is they want to do, by recognizing it could be a physical issue, but maybe it's a cognitive issue, maybe it's a social issue. We don't know. We have to dive down and break down that activity first to figure out where the barriers are, and then work with people to figure out how to solve those barriers. So it's that creativity, that innovation piece that when we were working with members of the community, felt very strongly that we keep that in. So we did design just that. We designed a curriculum that has a very strong science component, but we have 2 design classes that I'm really excited about because they're just that. They're fun design classes to try to think about, okay, how could you use this particular activity from a therapeutic perspective? How could you use this activity from a therapeutic perspective? So we're excited about that. And we also, one of the things that the community said too is that experiential learning is really important. And for me personally, experiential learning is also very important. So we're designing this program so that while the students are in the program, they are very much in the community as well. And a lot of their coursework is happening not just in the classroom, but out in the community. So we're excited to pull that experiential learning in right away, first semester when the students are here, so that they can learn in the classroom, but really be out in the clinic a lot. So that's very exciting as well. All OT programs, we're not unique in this. All OT programs will have 6 months of fieldwork, and that's the level 2 fieldwork. And what that means is that once you finish the didactic portion of our curriculum, you then get to head out, in all likelihood, anywhere in the country. And you'll do 3 months of clinical placement in one setting and 3 months of clinical placement in another setting. And what we try to do is we try to make sure that you don't do like all 6 months in pediatrics. And do maybe 3 months in pediatrics, 3 months in adult phys dis, or 3 months in mental health. We try to mix it up because that is really where you are out there working in the clinic, in the hospital with an OT, and all the information that you've learned while you're at UVM is what you are bringing into that clinical experience. So you'll have those 6 months of field work. And then our program is an entry-level doctorate program. And one of the criteria to have an entry-level doctorate program is that all students have to do a capstone project and experience. And when I went to OT school, we didn't have entry-level doctorates, but we do now. And I think for me, this would have been a blast because what you get to do with your capstone is you get to individually say, this is what I want to explore while I'm at UVM. This is how I want to, when I leave this program, I'm going to be different because of this. And maybe you're interested in research. Maybe you're interested in some technique that you really want to become an expert in. Maybe you're interested in advocacy. This can go in so many different directions. And you'll work with our faculty to design your capstone project. And then once that's designed and after you've done your fieldwork, then you head out on a capstone experience. And for 14 weeks, you kind of get to choose who you're going to work with. So let's say that you're in the program and you've been reading just a lot about one particular person who does some very interesting treatment technique as it relates to in pediatrics. And you reach out to this person and say, can I just come to your clinic for 14 weeks and really learn from you? You're going to get that opportunity in this program. And I think that that is really, exciting because you get to do what you want to do, right? But then also you're leaving with a unique skill. And I think that that's really cool. So that's kind of what our program is. And this is an important thing for people to know, is that we are currently in the applicant stage. We should know within, I think, 2 to 3 weeks about our candidacy application. Once we are approved for candidacy, which I believe we're being voted on this week, then we can officially start accepting students for next year. So we are right now on par to open up our first cohort of students for fall of 2022. And our application is actually open already. And once we hear about our candidacy, we will start reviewing those applications. And I anticipate within 4 weeks, we'll start reviewing applications now for a fall of 2022 start. So it's just good for people to kind of know where we are in the process. And this is how accreditation works for all OT programs. So we're just, kind of right in the normal path with all of that stuff. This is information that you can find on our website. These are all of the admissions requirements. So you can, I'm not going to read them all, but you can review all that stuff. The 40 observation hours, because of COVID, we are waiving that for our very first cohort. It's been a struggle for people to get into hospitals and clinics to just observe because so many places, I I mean, even when I take my son to the dentist, I still can't go in. So I'm like the mom and I still can't get in. So the observation's been a little tricky here. So we are waiving that for this very first cycle. But our application's open, and it is open for a fall 2022 start date. Our program is 98 credits, and it's 8 semesters year round. We are a hybrid program. Most of our program is face-to-face. However, we do have some online classes, and we do have an online semester, which is the very first summer semester. And that was we designed that in a very intentional way so that if students need to, move back home, if students need to work, there's the ability for some flexibility in the summer. So we were very intentional about designing our program that way.
Very smart.
Thank you. And so for our application, so we use the OTCAS system, which is very standard, and I think almost all OT programs use that. It is open, and when you go into the OTCAS system, UVM is one of the programs that you can click on. And we are asking for 3 letters of recommendation, 1 academic letter, 2 professional letters, preferably 1 by an OT. I've worked, in other programs in the past, and we've always required 1 by an OT, but because of COVID and some of those challenges, we're being a little more flexible with that as well. And then we do need your official transcripts uploaded. That stuff then all gets verified in the OTCAS system, and sometimes that can take like 4 to 6 weeks for the entire application once it's been uploaded to be verified. Once it's verified, then it comes to us, and then that's when we start reviewing applications. And then the UVM Grad College also has a supplemental application, and that you can find on the website as well. So once you go through the OTCAS system, you get all that taken care of, then you would do the supplemental UVM graduate application as well. And I think that is, and actually, I mean, Nicole, is this a good time for some questions in case there just are questions related to just the entry level before we start talking about
that's exactly what I was thinking too. Is Allie or Katie just wanted to see if there's anything that you want to, and plenty of time to ask questions. Victoria's not leaving us, but just wanted to give you the opportunity to, if there's something specific about the program or application process, please do add that to the chat box and we'll get to that. And thank you, Victoria, for going over that. It was really fascinating to hear how the program has been developed, what input has been involved with OT professionals. That's really fantastic. And also just keeping an eye on the flexibility that professionals and students need today. So the way that you've structured the semesters and the curriculum sounds really incredible. And so I think the OT professionals are going to be so excited at this opportunity here at Vermont. And so one of the things that I mentioned right in the beginning for Allie and Kate, I think maybe you were a little late when I said in the beginning that some folks may be coming into the OTD program and might not have the requirements needed, or might want to boost or bolster the requirements needed. So that's where I wanted to share with you as well the Post-Bacc Premedical program that we have, a long established program here at the University of Vermont, and there is a new PreOT track to make sure we're setting students up that may need the extra requirements or just increased maybe that GPA to do that through the PreOT track in our Post-Bacc Premedical program, as well to set them up for success in the OTD program at UVM. So that's really just what is on that slide, that this is an opportunity for students if they're not feeling comfortable yet with their application process, that and plus the timing, thinking about the fact that the OTD program starts next fall. Are there prerequisites that you might want to work on this fall, this spring, or maybe next summer to start making sure that that application is where you want it to be for the OTD program. And so what is the Post-Bacc Premedical program? And Victoria and I were talking earlier that, pre-med, calling it pre-med is a little misleading at this point because we have so many different tracks. We have dental tracks, specialized dental tracks, OT tracks, veterinary tracks, nurse practitioner. So it's very broad in terms of the areas of specialized tracks that students can go through here at the University of Vermont onto that pre-health career. And so what are some of the unique benefits that pre-OT, post-Bacc, pre-med students would have at the University of Vermont as you're preparing to go into your OTD program is the connection to University of Vermont Medical Center in a level 1 trauma center. That is something that all of our post-Bacc students just find incredibly valuable, the access to the opportunity for a patient experience, research. You know, we have students that have researched projects, been published throughout their post-Bacc premedical program as they're on their path to that next step. And so that is an incredibly important attribute of the program for all of our folks who are interested in a career in health. And so you can just see some of the attributes that are there. And one of the things too that Victoria was talking about is the clinical experience and opportunity that you will have through the OTD program. So how do we prepare you for that is also the linkage agreements that we have in the pre-OT. So as you're getting ready to go into the OTD program, if you meet some criteria, you will have a guaranteed interview with the OTD program at the College of Nursing and Health Sciences. So there's a linkage agreement for our pre-OT students. In addition to, as I mentioned, the UVM Medical Center, just the opportunity to gain that experience, that patient experience that we will continue to grow and have available for our pre-OT students. There's just a listing of all the different tracks that are in. As I said, we probably should call it the pre-medical, the post-baccalaureate pre-health program at this point, because it's very diverse in our tracks and including the new pre-occupational therapy. One of the things that's so important for our students to think about, if indeed, and Allie and Katie, maybe this is a question for you if you feel comfortable putting in the chat box, do you think you need that pre-OT work? Or are you going straight into the application process for the OTD program? If indeed you are interested in the pre-OT, that post-baccalaureate pre-OT program, there's an amazing community. And so it is one of the most supportive student communities on campus, probably. Everybody's in it together to help each other achieve their goals in whatever it is you're looking to do in the health community. There are mentors, and we'll be looking for more mentors and looking forward to having our OTDs, our students that go through the program, be mentors for pre-OTs in the future. So a lot of great things that are happening as you go on to your path for that OTD. And so if indeed, and I see Katie's adding something, but if indeed it is those prereqs that you're looking for, what are those deadlines? And as I said, if you're thinking about, you know, is it this fall that you need to add a few courses under your belt or improve to be able to get in? Oh, good. Katie says she needs some help. This is great. Okay. This is why we're doing this. This is exactly why there is a pre-OT track to prepare students for the success in the OTD program. And so you can see some of those deadlines there, and there are still spaces available for fall courses. In fact, there are still scholarships available for the fall courses. So please, if you are interested, and Kelly on our team, I'm going to ask if you could just pop the Post-Bacc Premedical website into the chat box for Katie. There are scholarships available for fall courses to get you ready for that application for the OTD program. And then if fall is a little too soon, because that is, here's August, it starts at the end of this month, you can look forward to the start date in January and the application timing for, we call it spring, but the January starts as well. And then how do you apply? You know, Katie, how do you do that? How do you get ready to get into the OTD program? It's a very simple application process, very similar to what Victoria just described, and it is indeed through the CAS system as well. So the central application system, you'll find UVM's Post-Bacc Premedical program in there as well. And so I do want to just put out there, please, questions, any questions that Katie may have, Allie, if there's something that you might, or Maggie, I know you work on our team, but if there's some question that you think would be great for Victoria to answer or us to answer related to the pre-OTD program. But if you're thinking about something after the event, it's always how it is, right? You forgot to ask your question. Please reach out. As I mentioned in the beginning, Victoria's email is right there. She would be happy to talk to you about any of the application process, curriculum, experience related to the OTD program, or a general inquiry. Email address is there for the College of Nursing and Health Sciences as well, and lots of information on our website. And then for Katie and maybe Allie, if this applies to you as well, if you need that pre-OT work, please let us know and email us at learn@uvm.edu. We also have chat on our website and our program pages, and you can ask any of those questions as well. So just another plug out to Katie, if you have any questions, or Allie, if you have any questions. But Victoria, I want to come back while we're waiting to see if anyone has any additional questions. The importance of the community, in the OT community, building this program with you. I don't know that we see that often. So is that unusual that has happened? And what do you think will be the benefit to our students that has happened?
I do think it's unusual, which is why it's so exciting to me. The benefit is that the OT community really knows what's going on, and they've really had a say in this, and they're really excited, and they're offering to take our students, as we think about experiential learning opportunities. If we want to get our students, if we want to do a class in a skilled nursing facility for a day, so that class is actually happening there, and then the students are venturing out and coming back, they're giving us ideas on different places that we could reach out to, or they're offering their facilities. So that's, I think, where that benefit comes from. Even people saying, I can come, I'm an expert in this. And I mean, they're offering to come in, I'll do a guest lecture. It's like, that's great, because we can't all be experts in everything. So I do think it's unique. And I think that's, for me, what's been so fun about it is just really, involving everyone. I mean, even after I designed the curriculum, I called everybody together, ordered a bunch of pizzas, and put the curriculum up there and said, okay, do you like it? What do you guys think? So it was fun. Yeah.
And we should go into it a little bit more, because you are incredibly experienced in this field, and we're so lucky to have you leading the development and the program. Just walk us through your experience, Victoria. And I know it was on the introduction slide, but it's always better to hear it from you. And where are you focusing? What is your energy and your passion in OT focused on, in addition to building this program, of course?
Right. So I'm a certified hand therapist as well. And that's been really where my clinical focus has been. And it's a very, very specialized part of OT practice. And I think that what I love about it is that it's so detailed and so intricate. So it's, believe it or not, it's very hard to rehab someone's hand, because like a basic scar on your leg, if you take that scar and you put it on your hand, it can just really tie down a ton of structures. And suddenly, I mean, I won't go into all this like detail, but I mean, you can like really lose the balance fast. And there's so many activities that we do. Like when I'm working with my students, I'll have them tie their thumb to their hand for a while in class and continue on in class, so that they can see just how important the thumb is for everyday activities. So for me, I just love the fact that it's so detailed and it's so hard to rehab, but yet it can really impact function. So that's where a lot of my work has been. But another area that I'm really getting excited about is home modifications and aging in place. So I actually just finished a certificate program on that. And I'm excited at the idea. I think there's a lot to be said for people living the life they want to live if they can live it where they want to live it. And so I'm excited to kind of branch into this area as well. And I think that my clinical practice is going to move me in that direction as well. So I guess those are kind of the areas that I'm passionate about. The other thing that I'm getting pulled into too is health and wellness, which I think is really interesting and hasn't been explored much. But I do think there's a lot to be said for how is your health and wellness impacted when you are able to perform the way you want to perform versus when you can't. And what's interesting is that as people go through life, their ability to do different things does change. And sometimes that's so minor how it happens, and before you know it, like you can't quite do what you used to be able to do. You're like, oh, I used to do that. What happened? Why can't I do it anymore? For me, it's interesting to think about, can we get people to where they're still able to do some of that stuff, and how does that impact health and wellness? That's a brand new area for me to explore, so I can't really go into like a lot of detail, but I've got some neat partnerships happening with folks at UVM, and I think we're going to start exploring that as well. So
And all of what you said is just so fascinating, given the other breadth of programs that we have at UVM. I think about our incredibly popular end of life care programs, the end of life doula program, just recognizing that people want to make their own choices as they age, and that there's more choices out there for them as they age. And how do people stay in their homes as they continue to age, as our population gets older? So fits right in. You think about the continuum of learning that people have here at the University of Vermont for our students. Yeah. That's really fascinating. Thank you for sharing that. And Katie is wanting to dig a little bit deeper. What drew you originally to occupational therapy, Victoria?
So it's funny because I get asked this question a lot, and I don't really have like a definitive aha moment when this happened for me, but I knew that I wanted to go into a profession where I'm helping people, right? But for me, my world is very gray. It's really not black and white. I have a very big creative side to me. And I also, I don't take no for an answer very well. So if somebody's like, oh, I can't do that. I just don't, to me, there's always a way to do things. So I kind of got pulled into OT because of that, because I needed to be able to use that creative side of me and this big gray zone that I work in. And it's, for me, the answer is never no. The answer is always, let's see if we can figure it out. And sometimes it doesn't work out, right? So for me, that's what pulled me into the OT profession, was my ability to think like that, to kind of really be a creative problem solver, I guess, in a very different way to help people.
Thank you. And great question, Katie. Thank you so much. And clearly, that experience and that passion that you have is demonstrated in the curriculum. Just talking about what you were sharing in the beginning about some creative classes and some design classes. So really cool work that's being done to develop our OTD program at UVM. So I want to come to a close. We're just got a couple minutes left here. If there's any additional questions that Katie or Allie or Maggie may have. But my last question for you, Victoria, is applications. Rolling admissions, is this something that you, once they're ready to be reviewed, because I'm thinking about Katie, who might need to get a few courses under her belt through the PreOT, will you be able to review those on a rolling basis?
Yes. Yep. We are doing rolling basis admissions.
Great. Wonderful. So Katie, there you go. Let's hope that you could maybe take advantage of the scholarship for this fall, get one of the courses under your belt to begin your process to apply for the OTD program. So thank you very much, Katie and Allie and Maggie, for joining us. And Victoria, thank you so much for sharing your passion about OT and the work that you're doing to set up what sounds like it's going to be an incredible program.
You're welcome. Thank you.
All right, great. Thank you, everybody. Have a wonderful afternoon. We'll share the recording. Take care. Bye-bye.
Thanks. Bye.